deformity, any deformity is there? Cross, right? Look at this. Okay. So you can have melatoe. Melatoe means the distal interphalangeal joint will be flexed. Hammertoe means hyperextension of the distal interphalangeal joint, flexion of the proximal interphalangeal joint, and hyperextension of the metatarsalphalangeal joint. Okay, that is hammertoe. Melatoe means flexion of the distal interphalangeal joint. Okay. Then what do we do? Claw-toe, flexion of the distal interphalangeal joint, flexion of the proximal interphalangeal joint, and extension of the MTP joint. Reflecting this on the toe. Then curly toe is flexion of the DIP, flexion of the PIP, extension of the flexion of the MTP. All will be flexed. Curly toe. Okay, then you got hallux valgus. So you can see all the toe deformities here. Some can move the toe. Make it easy for them. No, this one only. This one is okay. You can see hallux valgus here. Okay, the hallux valgus, bunion. Okay, all those deformities there. Okay. You can see claw toe. Right, brittle nail is here. Brittle nail, you can see. Okay, brittle nail. Diabetic neuropathy. Okay, so why does deformity happen?
The tendon.
Okay. So in history, when you ask for peripheral neuropathy signs of peripheral neuropathy. There's also autonomic neuropathy. Autonomic neuropathy, you ask all signs. There's another component which is motor neurons. So whenever neuropathy happens, you must know that motor neurons get affected also. So the nerves which supply the muscles also get affected. So what will happen to the muscles? You actually get atrophy. So the normal, whenever you walk, the way you apply pressure on the foot is distributed. So your foot doesn't get deformed. So you can read up on the ligaments also. You have the medial ligament, lateral ligament, okay? Spring effect to bear weight. If you look at your shoes when you walk, you go like that shoe, if you look at the sole, you'll notice that it won't the wearing of the sole of the shoe won't happen uniformly. It will happen usually where? At the lateral part. Only the lateral part will degenerate because that's where the weight bearing is. So all this, when the motor neurons get affected, you'll get wasting. This is like peripheral nerves on the upper limb, right? When median nerve gets affected, you get thenar eminence wasting. So similarly, the intrinsic muscles of the foot will get wasted. So the way the pressure gets distributed changes. So the pressure distribution around the foot will change, and that will deform, give a bony deformity.